Hello, my name is Corey Iqbal. I'm a pediatric surgeon at Overland Park Regional Medical Center. I'm the medical director of pediatric and fetal surgery there. Today we're talking about appendicitis. Appendicitis is a very common illness, it's very common in children, and it creates a lot of anxiety for parents because it is so common. In fact, it's the number one reason for children to need to have any sort of abdominal surgical procedure. So what is the appendix? The appendix is a small organ, looks kind of like a worm, almost like my pinky finger, and it hangs off the large intestine, sits down in the right lower part of our tummy. And the inside of it has a small little opening that gets plugged with poop. And that blocks it and leads to an infection on the other side. It's no different than getting a pimple on your face. A pore gets blocked and you end up with a zit. Unlike the zit on your face, though, we don't want to pop the appendix. Otherwise, the infection would spill in the abdomen and the child would get very, very sick. Appendicitis typically presents with abdominal pain. And that's what is very stressful for parents because abdominal pain is a very common complaint among children. I have 3 kids and almost weekly, one of them's got a tummy ache. So how do we distinguish what is a serious tummy ache that needs to be evaluated by a healthcare provider, or is just the run-of-the-mill tummy ache that's going to resolve within a few hours? The most common causes of a tummy ache in a child is either constipation or viral gastroenteritis, but you definitely have to be concerned about appendicitis, particularly when the tummy ache persists beyond 12 or 24 hours. The typical course for appendicitis or the presentation of appendicitis is that the child will complain of a vague tummy ache kind of around the belly button. And that's the early phase of appendicitis when the appendix just starts to begin to swell. As the appendicitis worsens, the appendix becomes inflamed on the outside and turns into a hot poker. And when that happens, the pain moves from around the belly button right to the right lower part of the abdomen. And so when there's a tummy ache that starts as a vague abdominal pain that then moves to the right lower part of the tummy, that needs to be taken seriously as possible appendicitis. When that happens, it's very painful for the child to move. So you may notice that the child just wants to lay still. They may walk with a limp. They may have other symptoms such as a low-grade fever. They don't want to eat oftentimes, and they may even throw up. Those are all warning signs that the child may have appendicitis and need to be evaluated. They should be seen by some healthcare provider that can examine their tummy and make a determination if they feel that this is consistent with appendicitis. There are pretty typical findings on exam that healthcare providers sort out whether they think it's appendicitis or something else. And then simple tests like a blood test, looking at the white blood count, which is a marker of infection, or something called a C-reactive protein, which is a marker of inflammation, can be measured, and an ultrasound or a scan can be done to actually look at the appendix if there's a high level of suspicion. If the child has appendicitis, it's easily treated these days. Most often that's a surgical procedure known as an appendectomy, where the surgeon goes in through small incisions laparoscopically and removes the appendix. That procedure takes about 30 minutes, and the child oftentimes is ready to go home the same day. So just to recap, when we're talking about abdominal pain in children, the things to be concerned about is the tummy ache that persists beyond 12 to 24 hours, pain that's localized to the right lower quadrant, or if the child's exhibiting other symptoms such as having a fever, refusing to eat, or throwing up. Those would be the signs and symptoms to look forward to determine if your child needs to be seen by a healthcare provider and have additional evaluation. So I hope this information is helpful for you the next time your child comes to you and complains of a tummy ache. And again, we're always available for you here at Overland Park Regional Medical Center to provide care for your children. Thank you.